Hello viewers, welcome to Daily Politics. On this program, we discuss issues around politics, policy and governance. I'm Hamza Idris. Senator Ibrahim Olorigbe, chairman of the Senate Committee on Health, has stated that a proposed bill which requires Nigerian medical doctors to practice for at least 5 years before receiving a full license will not effectively address the issue of brain drain. Many Nigerian medical professionals have been leaving the country to work in other countries, which has caused many challenges to the healthcare delivery in Nigeria. Recall that Honorable Ganiu Abiodun Johnson from Lagos recently sponsored a bill that passed the second reading in the House of Representatives, which mandates 5 years of work in Nigeria by Nigerian doctors before receiving a full practicing license. However, Senator Olorigbe argues that most of the doctors who leave are not new graduates and that the bill will not solve the problem of brain drain. He suggests that the government must invest in the health sector and provide better remuneration and incentives for doctors, adding that the working environment, including security and the availability of necessary tools, must be improved to prevent medical professionals from leaving the country. And closely related to that is that Dr. Uche Roland Onima, the president of the Nigerian Medical Association, said that many qualified doctors in Nigeria are still unemployed despite the brain drain in the health sector. He made this known while discussing the exodus of Nigerian medical practitioners leaving the country for greener pastures abroad. Reacting to the proposed bill sponsored by Honorable Ganiu Johnson on withholding licenses of doctors for 5 years, Dr. Ojima argued that the policy does not make sense, adding that jobs and good remuneration should be given to the many doctors still seeking employment in the country. He also highlighted that doctors to patient ratio in Nigeria is far higher than the World Health Organization's recommended ratio of 1 doctor to 600 patients. Dr. Ojima attributed the reasons for doctors leaving Nigeria to poverty, heavy taxation, insecurity, and a lack of equipment for them to work with in most hospitals in Nigeria. And now to our main topic of discussion. Did you know that Nigeria has a National Senior Citizens Act? The act was signed into law in 2018 by President Muhammadu Buhari, a significant step towards ensuring that the needs of the elderly population are met. The act led to the creation of the National Senior Citizens Center, domiciled in the Ministry of Humanitarian Affairs, and is responsible for providing assistance and support to senior citizens in the country as part of the government's commitment to improving the welfare of its elderly citizens. However, years down the line, how far has it fared? On the program tonight, we are joined by Dr. M.M. Omokaro. She is the Director General, National Senior Citizen Center. Aside being DG of NSCC, she is also the President, Gerontology Association of Nigeria, and previously served as the Deputy Chair, Global Alliance for Rights of Older Persons, GARO. Welcome to the program.
Thank you.
We're happy having you.
Thank you. I'm
in
very
our
excited.
Studio. Yes, we've been looking for you for quite a while.
Thank you.
Okay, yeah. I think the act was signed in 2017. Maybe
2017,
I should
yes.
Yeah,
and
exactly.
then the National Senior Citizen Center was set up, established in 2021.
Exactly, 2021. Yes.
Just 1 year.
Yeah, viewers will go on a quick break now, and when we return, the conversation commences. Stay with us. Yes, ma. Once again, welcome to our studios. Before we discuss the topic of the day, what is your take on this back and forth on withholding the licenses of doctors to address brain drain in Nigeria?
I believe really that to tackle any challenge, when you're looking at social policy in this aspect, legislation,
yes,
you have to look at the cause. The root cause of the social problem. And I think this one is multidimensional.
Oh, it's multidimensional.
Yes, and it's also about rights, freedom, right to independence and autonomy of the graduates. And it's also about the desire to have enabling environmental work.
Yeah.
So I believe that for it to be sustainable, it cannot only be legislation to stop.
Okay, the legislation will not actually solve the problem.
It has to be a needs assessment.
Okay.
And then a policy action issue to tackle and ensure that the environment is friendly.
Yes.
Remuneration, work environment, all the conditions, that make you happy to have spent those many years, getting the certification.
Yes, the irony, Doctor, is that you can see the chairman of the medical council. He said, in fact, the doctors are there, the job not there,
exactly.
On one hand. But while the government is now saying you should not go anywhere.
So I believe that whereas the government has seen the challenge of out-migration of our professionals, because it's in droves.
Yes.
And that is a problem also to be checked. Because, of course, the population of Nigeria.
Yes.
And it's still increasing. We are talking about 200 and something million.
Yes.
That is a genuine concern. So I believe that it should be the attention to it should be both policy, planning, program, development, investment, and then, of course, now find a situation where the doctors are not even willing to go out.
Yeah.
Because they find it very...
if the environment is conducive, they will not find anything attractive outside.
And where that consensus at the National Senior Citizen Center is because we really need doctors, medical professionals in the rural areas.
Yes,
because
deep into the program, I was even ask you questions whether you have even the professionals. 70% of our older
persons live in the rural areas.
Yeah.
So that is our concern, human resource in terms of geriatric care, health and social care, primary care, that's prevention, promotion, and all that.
Yes.
That's our concern.
So what do you think government should do now? Because it's actually two sides of the coin. Here, you don't want them to go, while those that are around are not really employed. And there is this comment, all over that Nigeria is just gradually becoming like an incubation ground for specialists, not necessarily in medical line. We spend a lot of money because how much does it cost to train a doctor? Now, the few years, they just leave.
I still come back to enabling environment, and I'll still come back to investments, and I'll also come back to, looking at how we can indeed extend, development, decentralized infrastructure.
Okay.
Where I'm sure those ones who are yet to be employed, maybe they're just still looking at opportunities in the urban centers, whereas our rural areas are really crying for.
And will you recommend this for other professionals, law, engineering, science, technology, and all that, IT?
But is to make a condition of employment very attractive. Make it attractive.
I hope so.
Make it desirable.
I hope the leaders
and invest some more.
All right. Thank you. Yes. Okay, now back to our main topic of discussion. Let's begin with your most recent global engagement, the 13th session of the open-ended working group on aging at the United Nations headquarters in New York. The takeaways for Nigeria, any?
The takeaway is that Nigeria is really front and center and very involved in the pursuit of a UN Convention on the Rights of Older Persons.
Okay.
And rightly so, because Nigeria has locally demonstrated goodwill and demonstrated commitment to ensuring the promotion and the strengthening of the rights of older persons. Right to be included in sustainable development agenda, right to age-friendly environment, and any other aspect of human index development. By the National Senior Citizen Center Act and the establishment of this very focal center that coordinates multi-sectoral aspects of development to ensure social inclusion of older persons. Nigeria is showing a good example, especially in the sub-Saharan African region,
Okay.
That
So a good
aging-
example.
Oh yes, that aging,
Despite all the complaints.
that aging is indeed a development issue, because before now you see that issues of older persons, if at all there was any attention to it, issues of older persons was seen as a welfare issue.
Yeah.
And you will find concerns for older persons domiciled in a welfare unit in a social development department. And there were, concerns mostly about pensions, because the
Yeah.
only act, was about pensions. So when you talk about older persons, you're talking about retirees, and you're talking about problems of pensions. Nobody considered continuing engagement of older persons.
Yeah.
Nobody considered aligning the medical needs of older persons to the health system.
Yeah.
Nobody considered, work schemes and inclusion of older persons. They didn't consider that older persons could be covered in national surveys for data disaggregation.
Yeah.
So older persons were practically invisible. They were totally invisible. And they suffered from a lot of discrimination, exclusion, prejudices, because the negative stereotypes. So it was that, okay, once you retire, go back home, and what is left for you except to die? Because they were not really at that center. So, but this present administration, with the signing of the National Senior Citizen Center Act.
Yeah,
And then
2021.
if you really take time to look at the act, you see that the act took a developmental approach. It took a human right approach.
Yes, I will ask that. But who is an elderly person?
60 years and above, I would say. That's mostly the mandatory age for retirement. Most public servants retire at 60.
Yes.
And the national policy on aging says 60, which we have now operationalized into the National Plan of Activity. However, the National Senior Citizen Center, talks about to enjoy the facilities of the National Senior Citizen Center.
And what are those facilities?
You have to be 70.
Yes, what are those facilities?
The mandate of the National Senior Citizen Center is to identify the needs of senior citizens and to cater for those needs. And it goes on to outline, the priority areas, and which will be the functions, what we should do. So first and foremost is to identify the needs to train, continue to build capacities of older persons.
Even after retirement?
Yes, which means
they need some capacity building.
Exactly, which means it recognizes that older people still have their expertise, their experiences, their skills, their passions, and they are bona fide right holders, and they have every right to still continue to engage and participate in the things they love and they have value for. And then it talks about development of enterprises and livelihood ventures for older people to continue to earn income or to supplement their income. It talks about development of programs in health and social care.
Yeah.
And then social programs, social assistance, safety net programs, any kind of assistance, recognizing that this population category also has a vulnerable.
In fact, they are more vulnerable than others.
Yes. And then, of course, it talks about sports, recreation, counseling services for older people, and then recognizes the need to develop a data system, keep records and statistics of older people, and ensure that we encourage the states and the local governments to also domesticate the act and then develop policies on aging, and then so that we can align our services to services of states and local government. And then, of course, to ensure that we also look out and then develop linkages with regional and global organizations to help us in whatever we do.
We did an editorial in this house a few weeks ago, and it generated mixed reactions, including from your agency. And what informed that editorial basically was that, of course, the president signed the act, right? The council on February 10th, 2021, if I'm correct, right? He ratified the national policy.
The national policy, yes,
exactly.
Yes.
And then now almost 2 years. And we still see the old people, we still see the complaints and all that. We have a special program. Our chairman in this company, there is this program we call Reminiscences. He interviews the elderly. Some are 80, some 90. But when you now ask them, how are they faring? Most of them say, we have been forgotten. It pains us. So, how far?
Yes, I'm very happy that you referred to that editorial. And I'm very happy also that you've given the National Senior Citizen Center an opportunity to also repeat maybe what's out there, but not a few people don't know. And then also to recall that you did interview me as well. You came to National Senior Citizen Center, and we still have, it was nearly 1 hour interview. And then you published, which you did concerning all that we have done. We are 1 year and some months. We are not 2 years yet. Like I told you, the board was inaugurated in 2021. So now, I want to start by saying that by establishing an agency, a pioneering agency, and establishing an agency, where you're not taking off from some background or something that was there. So now you sign an act, and then there's a national policy on aging. So what do? We had now to operationalize the act, translate it clearly into vision and mission, and then into a roadmap of what we are going to do in the next 10 years. So as I'm talking to you now, we have
it's not a one-off thing.
We have launched a strategic roadmap for 10 years, which if you pick that document, all our partners now are picking the document, even our global partners, and they're like, yes, Nigeria is really serious about this. This is where they are, this is where they want to be. They've identified all the challenges, all the aspects, and they have broken them now. Then we also took the national policy on aging. And because that's a policy, that's just a document. So how do you take this to the field? We're able to operationalize that document. So now we have a national plan of action on aging, and then we now broke it down to project activities, which we now, integrated into the national development plan.
With timelines?
2025, with time, not just timelines. Programs clearly developed, objectives and justifications, and the strategy you want to, if you pick it, you really know, you can follow our programs and see what we are doing. And then structuring the multi-sectoral partnerships that you need to make this happen, and then your key performance indicators and your timeline. And then what else did we do? Aging is multi-sectoral, but people don't understand that. So you discover that all the existing ministries, departments, and agencies have mandates and plans of activities that should include older people. But over these years, they were never included. They are forgotten. Everything about older persons was about pensions, whereas it should not be so.
Which is already been forthcoming.
It should not be so.
Even the one that those that get it is so.
Which should not be so.
It will not take care
so
of
we
them.
now had to visit every single MDA that had a statutory mandate that intersects us. I just mentioned health. I mentioned entrepreneurship and livelihood
which is
ventures.
maybe Ministry of Industry. And
I mentioned sports and recreation. I mentioned social programs. As you're talking about social safety nets, you're talking about social assistance programs. And then, of course, I mentioned counseling. I mentioned data disaggregation and building data system. I'm sure you know that there are ministries, agencies, departments that hold these statutory mandates. You can add the age-friendly environment, housing, transportation. And all those. So now, in visiting all these MDAs, we had to identify their mandates and ways it intersects us. That's why one of our strategies was aging mainstreaming. Meaning, find where these programs already exist and where older persons were hitherto excluded. And then make a high point of persuasion. And not just make a high point of persuasion, but now enhance their capacity to understand aging. And then enhance their capacity from the point of view of their statutory mandate to understand the kinds of program that is age specific that they can develop. And then we can work with them to ensure that older persons are socially included.
But are they on the same
And
page?
as I speak,
all these ministries and agencies.
as I speak to you now, we have 32 MDAs that have aging desk with 2 focal officers trained.
32.
Yes.
Wow.
And we have signed MOUs with ministries on projects developed either by us or their own project that we are mainstreaming older people in.
Yeah.
So I give you an example.
Okay.
Now, we just signed an MOU with the Federal Ministry of Health. Why? Because we are concerned about geriatric care.
Yes.
That is not primarily our mandate. It's primarily the mandate of Ministry of Health.
Yes.
But it's our mandate because our focus is on older people. So how do we partner to align the needs of older persons into the health programs that you have and schemes? And where it concerns us is that we have 70% of our older persons in the rural areas. We have a great percentage of older persons needing long-term care. And we have a percentage of older persons, many who cannot access the appropriate, the affordable, the acceptable, and that kind of care that, can go to their doorstep.
Exactly.
So what are we doing? So what did we do? Why did we sign the agreement? Now, we want to develop, and not just with Ministry of Health we signed, we have a partnership with NBTE,
National Board for Technical Education.
And I tell you, why? Because we see a huge gap. We see the need to develop a national benchmark statement and minimum standards in curriculum to train caregivers.
Yeah, because not everyone that has
it's
the
a
capacity.
skill. You don't have the capacity. You must understand the older persons. You must understand the ethics. You must understand the multi-morbidity nature of what they suffer. You must understand the different kinds of care settings. And then you must understand the family dynamics. You must understand different kinds of things. And so we just said, older persons have suffered abuse. And then the adult children taking care of older persons are sandwiched. That's a sandwiched generation. You're taking care of your children, you're taking care of older people, and you're working. You're going to work. So most of our older persons are abandoned with minors.
Yeah, and they can't take care of them.
They can't take care. And then so you find a situation where you have agencies just growing up and calling themselves care agencies. There's no standardization, there's no certification, there's no monitoring, there's no evaluation.
So you're not bringing them together.
That is what we're doing. So now, with this standard curriculum and training, we will be able to work with NBTE to certify. Any care agency before now was any care agency. So now we want to certify care agencies, we want to train caregivers, we want to have a basic entry requirement, and working with NBTE.
Is it that they have to go to maybe certain institutions for training?
No, we are going to have training agencies.
Okay.
That's why we are working with NBTE.
Okay.
We can even we will even train informal caregivers, just in the interest of our older people.
Recently, I read about one of the former presidents of the United States. He's around 90 something. I can't recall.
Is that Carter?
Exactly. That he's going into this kind of care, meaning leaving the hospital, back home.
And there are different kinds of care setting. We are interested in making sure that we can have domiciliary care, that's home care, that you can have trained caregivers going to homes using the care agency model. Then we can also have trained and certified agencies that can run some residential homes. They're already running some of those ones, but they are not standardized. So in terms of health, so you see our partnership with Federal Ministry of Health. And then we also have a partnership with National Primary Health Development Agency. Why? Because we want integrated care for older persons mainstreamed into primary health care system.
But it appears very expensive. I made attempts to register one of my aunties, sisters of my mom, and when I approached one of the healthcare organization, the MHOs, right? HMOs, I mean, they gave me a bill of nearly 200,000 compared to less than 50,000 for a newborn baby.
No, I don't know what care you needed. I don't know. Was that
it's
like
just to be enrolled for healthcare? They said that
health insurance.
For health insurance.
Yes. So no, but I think that now with the national health insurance Authority Act.
Yes.
Older persons who are vulnerable, poor and vulnerable, have been identified to enjoy, a coverage, free coverage without paying dividend. It's in the Act. And NHIS, and we are working
Where
on
is
that.
it going to come to life?
Yes, no, the Act was just signed this year, so we're working on that to see, because you need a pool of money to do that. And then, of course, NHIS also has developed community-based care system that the states, that we are working also with some states to see how older persons can benefit. And with what we're doing, training caregivers and certifying agencies and certifying things, we are bringing sanity to an industry that we can now work with National Health Insurance Scheme and work with even other insurance companies, because we are trying in the long run to develop a sanitized long-term care system. So that's why I told you that there was nothing at all. So we now start to build these policy guidelines, these benchmark statements, these minimum standards, and then bring certification, all in the interest of protecting our older people. So this is just one example. And then another example, we're talking about, you asked the question, so this MD is also, what is it? We also have an agreement,
how are they really working
partnership
together?
with National Directorate of Employment.
Okay.
And we have mainstreamed our older people into their mature people program. And our older people are receiving grants and loans for their entrepreneurship activities and their livelihood ventures. We are now working with Smidan, which is
Small
going to
and
be
medium enterprises development agency.
Yeah. So in that area of income security, now we are bringing visibility to older persons who are continuing to engage and continuing to contribute. And these are entrepreneurs. They have livelihood ventures. It's just that before now, they were invisible. Before now, it was so stereotypical that should you give an older person loan, he's going to fall down and die.
Yeah.
So we are trying to reprogram people's minds that you can't find a typical older person. You can find one that is frail and old and sick, but you can find a 70-year-old that is more vibrant than a 30-year-old.
Yeah.
And with all their expertise and experiences, and we can harness all that.
Yes.
So under entrepreneurship, we have developed so many things. We just finished a national assessment of senior-led indigenous crafts.
Yes, I have
NDE.
that question, but so far, how many have you captured in your data bank? How many old people have you captured so far?
Okay, now this is what we did concerning the data.
Yeah, because the World Bank says
when we came,
about 5.8 million Nigerians are old.
No, that is not correct.
Okay.
We are more than that.
Okay, it's more than that, but more than that. But the World Bank captured this, yeah.
No, we don't depend. It depend on.
Okay, the one yours.
Within before you go to.
Okay.
So now, if you follow from the Nigerian Living Standards Survey,
yeah,
we are waiting for the census next year so that we can now know when it's disaggregated. We can now confirm the numbers. But because MBS has been in the field doing national surveys, and MBS has sat with us to disaggregate data for us.
Okay.
So the data we have from NBS, from the National Living for 2019 was 14.8 million older persons.
14 million, those that are 60
years
and above. 14 million.
60 years and above.
Wow.
And 2 years after that, it came to 16 million. And
is it that the life expectancy has improved? Or?
Life expectancy 54, 56 years. But now life expectancy, you are taking the average of So but when you look at the persons retiring, just go to head of service and ask how many people retire in a day.
Wow.
You look at people hitting 60, and you look at the world projection, population, aging population projection. In the next, by 2030, there will be more older persons than you have persons under 20.
Wow.
And Nigeria, yes, we have a young population because the median age is still 17 years, 18 years. But Nigeria is gradually getting there. By 2050, that median age is shifting to 34. And then you see the growth. 14, 16. By 2050, Nigeria will have 30 million older persons. 30 million older persons.
That's a huge.
So as for data, we got data from disaggregated data from NBS. We got data from NASCO, that is the National Social Social Security Coordinating Office.
Yes.
We have data on the poor and the vulnerable up to any local government you want to mention. So we have that data and they are still capturing. So we know the number of older persons in the social register. Okay. So to just end this part, our relationship with the MDAs, these 32 MDAs, which we have trained their focal officer. In fact, having developed,
you say they have desks.
Have national roadmap and the plan of action. We are retraining them so that we can now fit in and develop a feedback mechanism. We are really serious about socially including older persons in every aspect of development.
All right, thank you. Now we'll take a short break, and then when we return, the conversation will continue. Viewers, remain with us. We'll be back shortly.
That's great. It's good to see you.
Welcome back. If you are just joining, you are watching Daily Politics on Trust TV. Do well to follow us across all our social platforms on Facebook, Instagram, and watch us live on YouTube. I still have Dr. M.M. Omokaro. She's the DG National Senior Citizens Center. Once again, welcome to the program.
Thank you very much.
Yes. Talking about capturing the data, what about those that have not been to school and they've never worked in the formal sector? They're all over the country. What are you doing to capture them and then to also give them access to some of these facilities?
Like I said, our focus actually is on communities. That is why we put very formidable stakeholders, consultative forums in every state.
Okay.
And 90% of membership are retirees. And then older persons, whether they be farmers, whether they be artisans. I was just telling you that we finished a national assessment of senior-led indigenous crafts.
Yes.
So these are rural artisans.
Oh,
yes. And we were in the 36 states and FCT. So we are coming out with a survey report about their challenges, about, source of raw material, marketing and all that. And having done that, having finished that assessment, we worked with NDE to build capacities of older persons. And we had what we call a proof of concept grant, which enabled them to expand.
Yeah.
And then now we have Grey and Vintage Fair, which will be showcasing a lot of these treasures, because we found treasures. Older persons are still the focal point for prosperity in their communities. And
so they're not aspired as
at all,
wrongly assumed by some people that once you are retired, you have aspired.
It's just that they've been excluded. They've been excluded. And largely we have ignored our indigenous crafts. And what is happening there, the fright there is that is getting a sting because our young people are not interested.
Yeah.
So now NSCC is taking an intergenerational approach in this empowerment, this craft empowerment.
Yeah.
So that now we are giving an opportunity for cooperatives, which includes, so we are putting them in clusters and forming cooperatives, and that's also around the states. So for economic empowerment, we have gone down to the remotest place to find our older persons.
Okay, is it part of what you launched in January? You published lofty documents, right? The NSCC Strategic Roadmap of Aging 2022-2033, and then the National Plan of Action and Project Activities 2021 to 2025.
Yes, I mentioned that earlier.
Yes.
That for us to take off, we had to know where we were going.
Yeah.
So we used the stakeholders consultative forums across which we formed to craft that document. And also the MDAs, 9 categories of stakeholders.
Yeah.
And we launched that, and we also have launched. So we have the foundation and the roadmap and the plan of action. and we are following.
Okay, is it a culture or religion in this part of the world that we don't have homes of the elderly where, because I've seen it in the US, I also saw it in Germany, that at certain age, because children have also found their way, now government pick these people, good homes, recreation facilities, the crafts and all that. So they live in a different world.
Okay, I was telling you when I said we are standardizing care. And I said there are many care settings. I mentioned the domiciliary as a home, especially for those needing long-term care, persons with dementia. And then I said there are also community care, and it's inside this community care setting that we are building our senior centers. Okay. That's what you're talking about, active senior centers.
Yes.
Where it's like a daycare, not care, but older persons in that community. In fact, we are launching our One Community, One Senior Center campaign because we need private sector involvement. So we have been holding private sector roundtable. So you can build in your community. Your philanthropists can come together. So we are crafting that policy guidelines and operational manual. This is the standard that you need to build a senior center. And so that we want to now be able to, monitor and evaluate and be the ones to develop programs that you can now adopt to fit your cultural context.
Yeah, that is the question
and we
I'm
have already
trying to
trained.
ask. That, okay, how are you carrying community leaders and religious leaders? Because for me, for instance, if I make the mistake of taking my mom to that place, the whole community will curse me.
This is what I'm trying to tell you.
Yeah.
There are different care settings.
Okay.
And we, as the culture admits, is that people prefer, even internationally now, because of COVID, you saw how many died in institutions.
Yes.
So they are now coming back to prefer aging in place. Aging in place meaning age and grow old where you are familiar with, in the place of your choice.
Okay.
So that is why we are training caregivers and certifying them and using agency models.
And these people are going to have certificates, these caregivers, that they are experts in that area.
Different levels, so that we can deploy them to communities and to homes.
And will they also operate privately going forward, maybe much later, whereby
the agencies
you can now
private.
pay them to come and...
The agencies are private agencies.
Excellent.
It's going to be private agencies. That's why I'm telling you. So we are now developing, in fact, we finished the draft, and we are working with NBTE, so that we can now pick who trains, who certifies, who is awarding body, all those things. So we are now sanitizing. So any older person or adult children can pick where they want their family to age. You want to stay in the home? Yes, you can get certified caregivers to come to your home and make sure that your home is age friendly and make sure that they can attend to whatever it is because they are trained depending on the level of the need of and the case management that they see in that home. Or if you choose residential homes, because sometimes, whether you like it or not, the market is opening. Some culture are averse to it, but there are some people who've lived abroad for so long, Nigerians in the diaspora, they are looking for a way to take their mothers to and enjoy professional care so that they can have peace of mind. That market is also opening. So we are also training and certifying private sector who want to open residential facilities. And then for these senior centers that we are talking about, that one is not residential. Okay. That one is a care center that you can go for sports, go for recreation, go for interaction with your peers. We develop intergenerational programs. So you get up and you have somewhere to go and interact because loneliness and aloneness kills. So Nigeria is coming to that place where because of the National Senior Citizen Center, so many things are put in place. Those structures, those mechanisms. And don't forget that we run a federal system where you have the federal government can do the overarching policy. And when it comes to issues of health, it's in the concurrent list. So you must persuade the states. You must, work with the state, build capacity, and then align with state and local governments so they can adopt the act, domesticate the act, and also you have that free way to partner with the states and then do what you need to do. Okay,
earlier you mentioned health, right? And now transportation. I know in other climes, older people, they have this special card that, while traveling, you don't need to pay. Just
I tell you that NSCC, I said, is looking at multi-sectoral and is looking at aging as a development issue.
Yes.
So and I told you that we are building capacities and creating partnership in all the MDAs.
Yes.
So when it comes to age-friendly transportation, age-friendly housing, and
sports,
age-friendly environment, we are working with NIMSI to develop this card that you're talking about.
Okay.
Because we had that presidential directive, that declaration, that we should progressively register older persons so that cards can be issued to them to be able to access discounts and and concessions,
Public transportation,
and
train.
priority treatment in public spaces, train and all that. So we have gone far on that. We've even developed a dummy, looking for where is the pool of money going to come from for that.
Because that is the other
Yes.
question I wanted
So now
to
that
ask.
is where we are, and then very soon, NIMS is really working very hard with us.
Now, that's National Identity Management.
Because that's just
Okay,
statutory
that is a
mandate.
commission.
That's just
Yours
statutory
is
mandate.
a center, right?
Yes, it's a center, but-
with, you know, the mandate is huge. What is your relationship with your mother ministry? Don't you think
Oh, my
you
mother
deserve to have a ministry of your own?
Well, now I tell you that it is my minister,
Yes.
just Sadiya Umar Farouk. Many ministers came before her. Humanitarian Affairs was just founded some few
Yeah,
years back.
Buhari created the Ministry of Humanitarian.
And advocates had been advocating for, but she came in and she facilitated, the inauguration of this and this establishment of this National Senior Citizen Center.
Yeah.
So that's the kudos to my ministry.
But
that
it
ministry.
appears the ministry
And
is
then
overloaded.
What we have done now is that the ministry is partnering with us. Wherever you see any national social investment program, the grant for poor and vulnerable, older persons are given a percentage.
Yeah.
So across this country, older persons have received that grant for the poor and vulnerable, that one-off grants. And right now we are working together with the ministry to now, mainstream some flagship programs into their NSIP programs.
Yeah.
So that older persons also, will be targeted as beneficiaries of the NSIP program. For instance, the entrepreneurship program. And I
Yeah.
told you what we have done in entrepreneurship. So some of those programs are going to be mainstreamed into the.
Okay, what
minister's
about
program.
what about those that are too old to do any other thing?
Yes.
Is it that there are plans for them to be getting some incentives, cash incentives, like in the
yes,
meantime?
So part of what we are discussing.
Okay.
I want to say that some percentage of older persons are in the conditional household grants. They are giving those grants to households. So, but we have moved and we are pushing. And I think I have the green lights, that older persons will be given a standalone social safety net. So we want to see that happen.
Yeah.
So that the older persons that are really poor and vulnerable, and this is end of life, so that it has to be a kind of social register that they don't exit because they are end of life, unlike other social register.
Yes, that at certain level
at some point you have to exit because you are okay now.
This one should be
This one
terminal.
should be terminal, yeah, because it happens in other climes. So which means it has to be really those older persons that need social care, and they are really poor and really vulnerable.
If I understand, what you are trying to do is that some old people, you see them praying that they should die because they feel so neglected,
So neglected,
that
so
they
ostracized.
prefer to die than to live.
But help has come because before now, nobody even noticed that they were older people. Before now, there was no visibility at all. Before now, it was total discrimination. Why? Because traditionally, it's a family that took care of older people. So over the years, that was the history we had.
So is it that you are trying to now relieve the families from taking on the whole burden?
Yes, we are trying to relieve the burden of care. In other clans, we're trying to strengthen family to care, and at the same time also take the part that government should take. Because older persons are also citizens of the country.
Yeah.
So where you have a primary healthcare center that mainstream geriatric care, it means that the older person can walk to the nearest primary healthcare center and have healthcare that is appropriate.
And it's like
for
a full
that age.
compensation for what they have done, their contribution for
specific.
serving.
And then health
country.
insurance also, they can be covered. and then you train caregivers and you make it accessible to the communities, you have done that. And you find an older person that is an artisan, has been struggling, and then you empower and give. You have expanded that thing. And then you bring back dignity, you bring back security, and for those who are really sick, and you ensure that, you know, care is given wherever they need that care and they want to stay for that care.
Wow.
So it's a whole gamut, and we're just 1 year old. But all the structures that we need, the partnerships that we need, the capacity building, the policy guidelines that we need, the programs we need to develop. In fact, we spent 1 year developing all this and test piloting these programs. That's why most of the things we do, we call it proof of concept. Why do we call it proof of concept? It means that this is proof that this can work.
Yeah.
And then once we now have proof of concept with the little budget that we were given, we say, now, if we have money, we can do more. If states, because I'm looking to engaging with Nigeria Governors Forum, because our older persons are their constituents, because they all live in the state and they live in the rural area. So once that opportunity comes, because we are engaging with the Governors Forum Secretariat, and we have introduced ourselves and they are, yes. So we will engage with them and say, this is the act, these are the policies and these which can be adopted. And this is the benefit of having a dedicated center that can coordinate. Because I tell you, if you do not have a center dedicated to aging, you have not started. Because as you see, aging involves multi-dimensional aspects and peculiar challenges because of that age specifics.
So are you now trying to see how you expand, is it the tax net or income net of the center to do more?
No, what we are going to do is that, I had said it before, I said if you look at the issues of aging, take it from both extremes. If you look at older persons that are full of vigor, they are healthy, they have their expertise and passions, and you give them opportunity to continue to engage, you give them opportunities to train more, upskill, they'll continue to make income and employ labor.
Okay.
So then they are contributing. And come to this extreme, and you have older persons that are really frail, and old and tired and sick. Then that's an opportunity for care. That's where all these agencies come in. That's where opportunities for employment is open. And that is that employment that we are creating. Because you have to create the mechanisms, the structures, and the processes. That's what NSCC is doing with NBTE and with Federal Ministry of Health and with National Primary Health Care. So in a short time, you will see the huge employment that is going to be opened up. They will need the states, government, to buy in. Because all the older persons are in their states.
Exactly.
So once the state governments buy in and adopt even 1, 2, 3 of our flagship programs, you will see the kinds of employment. You see the radiance that will return to old age. And I forgot to tell you, there is another program. We have many programs we develop. There's another one that we are launching very soon. We just had the service level collaboration dummy evaluation. Continuing Engagement Bureau. That is like Experience Corps. Like you have the National Youth Service Corps. We are creating a National Experience Corps for all our retirees. Whether
like
you retire, whether you retired from the informal sector, whether you retired from the government sector, whether you're coming back as a diplomat, whether you served in the army, once you're 60 years and up and you retire and you want to continue to engage. So we are building our own LinkedIn. You know LinkedIn? That is the platform that we are building.
Excellent.
So there, you
all
have,
people, all people.
And we've gone far. In fact, we just went to view the dummy.
Okay.
So we called, we have some stakeholders at that service level.
And you think they are internet savvy, most of those people?
We are going to train them because we have programs in technology. And it's intergenerational, where we even have apps that will speak different languages. The Hausa, Yoruba, Igbo. In fact, we have one now that we are building that speaks Pidgin. You know. So NSCC is taking the whole sector-wide approach, and we are leaving nothing out.
Okay, then what about funding? What are your challenges, or are you satisfied with what you are getting now?
If you gave me 5, 10, 6, 17 billion, Nigeria would turn around in a jiffy because we have the program.
Okay.
I say if you gave me.
But do you have it now?
We don't have at all. So we just have, when something is starting newly, and especially aging, that persons really don't understand.
Yes.
Because when they say the National Senior Citizen Center Act, a lot of people are still thinking that it's still that welfare program.
Yes.
What are you doing for older people?
Yeah.
Really, older people? Really? I say, really, yes. I am an older person.
Yes.
And I come with my experiences and expertise and all that. And there are so many people like me. You understand? So it is a very heterogeneous population. And this population can continue to create wealth in this country.
If well taken care of.
Yes. If you give them health insurance, you give them access to good health, you give them enabling environment, and then you bring a pool. These are the brain trust we have. These are consultants that we have. These are angel investors for our youth.
Yes.
That is what NSCC is.
So can you suggest to government as to how to fund you? Yes, you are. Yes, but can you now make some suggestions to the wider government on how to fund you properly so that you have this 17 billion, 20 billion, 30 billion?
First and foremost, I want to thank the government.
Okay.
This present government of President Muhammadu Buhari. I say this because I've been in this field since 2005. My PhD was in this field.
Okay.
And I now became an advocate for this field because of the data that my PhD showed up. I worked with NSCC as a visiting scholar.
You have actually a rich resume.
Develop curriculum. So for a long time, we're trying to make government see the need to include older people. But this present administration, President Muhammadu Buhari, His Excellency, signed that bill.
And you hope Tinubu will continue from there?
I'm sure he will, because it's the same party.
Okay, apart from Tinubu, are you advocating private sector investment?
That's why we're holding private sector roundtable. For instance, one community, one senior center.
Yes.
Private sector should come and brand it.
All right.
All these communications agencies, organizations, come. If you want to paint it green, paint it yellow, anything you want to paint it, but give your community a senior center. We will develop the programs.
Okay.
We will build that capacity.
Thank you very much. And give a final word to the elderly now. Give them just one word.
I forgot to mention one of the programs that is so dear to my heart. Grandmothers Arise, older women.
Okay.
Older farmers, older artisans, women that we have formed into cooperatives. In fact, we are test running it in Buhari here. We can go together. So
we'll bring you back to shed more light.
We got a farm, we're giving them seedlings. And when I say sector-wide, we have brought in RWASA there for sanitation, hygiene, to build, to stop open defecation. We have brought in health insurance there. We have brought in water board there. We have brought in SMIDAN is there. So wherever NSCC moves, we move with a whole sector-wide because we want to impact that community.
Wow, congratulations.
Thank you so much.
Yes.
Thank you very much.
We thank you for coming, Dr. M.M. Omakaro, Director General, National Senior Citizen Center, for your well-informed perspective on the elderly. And we hope that matter will key in so that you get it right.
I pray that the governors, when they are seated, they will invite us to.
All right, thank you. And that's a wrap on today's program. Viewers, thanks for watching, and do join us again for another interesting package. I'm Hamza Idris. Bye-bye for now.